What's going on, everyone? Update number 2 on my knee. It's been about 5 days since I hurt it, and it has gotten better, but every time and then I think it's going to get fully better, it continues to just backtrack again. Basically what's going on now, the swelling has gone down and the overall pain has gone down. My motion is still a little limited into flexion. I think that's mainly due to some swelling because I feel the pressure and the tension across the front of the knee. And then I think my body continues to not want me to fully extend my knee because when I do, I can feel like my hamstrings and even my calf are all jacked up and just working too hard because whenever I straighten them, it really puts some strain and stress on that. So I still want to subconsciously avoid full knee extension. With that being said, I have still been doing my own rehab and working on some stuff, so let's show you what I've been working on.
Since I've been having some issues with bending my knee, I have been doing a gapping mobilization of my knee joint. So basically, I'm lying down as shown here, placing my forearm of one arm behind my knee joint and using my hand on the other arm to help slowly push my knee down and bend it some more. Creating this gapping will allow some more space in the joint itself, allowing me to get further into that knee bending motion with less pain. I do this for about maybe 2 minutes. Since the onset of the pain, I have been having some issues with recruiting my quad on this side, and I have been able to improve my recruitment of my quad and being able to do just like an isometric contraction when it's fully extended. And then I wanted to continue to increase that challenge by keeping it fully extended and performing a straight leg raise as shown here. As you can tell, I do struggle a little bit now and then with getting it fully straight, but this is a great way to continue to work the quad and challenge it some more, especially at a very low level. Speaking of quad recruitment, especially at end ranges of full knee straightening, I decided to do a standing terminal knee extension. This is just where our knee is slightly bent, very close to the end range of full knee straightening, and we straighten it out by contracting our quad. I like to utilize some sort of object, usually something soft like a rolled up sweatshirt or a pillow, and place that behind my knee joint to give myself some feedback. I also have my hand on my quad feeling that contraction as well, because some people will cheat and utilize their hip extensors like their glutes or the hamstrings to really straighten their knee, which is not what we're aiming for. So doing this, trying to hold for anywhere between 5 to 10 seconds and doing about a set of 8 to 15. And the last exercise I've been working on is a partial range wall squat and holding for some time. The reason I'm mainly focusing on quad strength is because I was losing some ability to contract my quad, again, especially at end ranges of knee extension. And it's very important to not lose that ability to do so. Otherwise, your knee is just going to continue to get weaker and you're just going to have trouble straightening your knee later down the line. So, this is why I've been focusing mainly on the quad to get that back and working again. This is a very easy exercise for me to do. It's pretty much non-painful since I'm going into a limited range of motion. And then from there, I am trying to make sure I utilize my quad to straighten out my knee at the end as I stand back up into that position. It's definitely tough. I'm not sure if you can tell in the video, but it's hard for me to straighten my knee fully on that left side in comparison to my right.
So that's it for this update. Continue to stay tuned for more updates regarding my left knee and see where this process goes.